This is ultrasound of a 14-year female patient presented to us with the severe pelvic pain, nausea and vomiting. This is ultrasound of the pelvic region. In this image, you can see there is a grossly edematous enlarged ovary. It was the suspected case of adnexal torsion. So what is adnexal torsion? Adnexal torsion is the twisting of an ovary around its own axis. There are the two very important ligaments, utero-ovarian and infundibulopelvic ligaments. So in adnexal torsion, ovary rotates on its own axis to cause the twist in the suspensory ligament that contains the vascular pedicle. In about 70% cases, adnexal torsion involves the both ovary as well as the fallopian tube. However, it can be isolated as well. There is a list of differential diagnoses if the patient comes to us with the severe pelvic pain, nausea and vomiting. Gynae-related conditions like physiological or the hemorrhagic cyst, pelvic inflammatory disease, ectopic pregnancy, torsion, endometriosis, ovarian hyperstimulation, fibroid with the necrosis or the prolapse, and the ovarian vein thrombosis, and the other non-gynecological entities like the appendicitis, enterocolitis, diverticulitis, bowel ischemia, inflammatory bowel disease, irritable bowel syndrome, urolithiasis, and cystitis. Let's come to the diagnosis of the adnexal torsion. Adnexal torsion is the fifth most common gynecological emergency. In the adnexal torsion, usually patient present with the severe acute pain, vomiting, and surgical abdomen. The diagnosis is usually made clinically as well as with the help of Doppler ultrasound. On the grayscale ultrasound, usually there is asymmetric enlargement of the ovary, and if there is no neoplastic lesion, the size is usually more than 5 centimeters. The ovarian parenchyma is usually thicker than the expected, and there is peripheralization of the follicles, which is called as the string of pearls or the follicular ring sign. In most of the cases, free fluid is also seen, although CT scan and MRI also very helpful for the diagnosis. However, due to the non-specific symptoms, the diagnosis is usually missed or delayed. The findings of Doppler ultrasound are very important. In the mild cases, there is high resistant arterial flow, while in the moderate cases, there is usually absent venous flow, and in the severe cases, there is absent arterial and venous flow. So the ovary can be saved if the diagnosis is made in the early stage with the surgical procedures, and if there is absent arterial and venous flow, the ovary cannot be saved even with the surgical procedures. So in conclusion, if a patient comes to you with a severe pelvic pain, nausea and vomiting, there should be a suspicion of the ovarian torsion. On ultrasound, ovarian edema is the hallmark feature for the ovarian torsion and manifests as the asymmetric ovarian enlargement thicker than the expected ovarian parenchyma with surrounding a lesion, adjacent free fluid and stromal changes with the heterogeneity at the ultrasound. On the Doppler ultrasound, there would be absent arterial and venous flow and whirlpool sign, which represent the twisted pedicle adjacent to the ovary, and there is unusual location of the ovaries, and the diagnosis should not be delayed because of the color Doppler flow or the contrast enhancement is still present, and the proper and the timely management is very important. This is the just recap of the symptom diagnosis and the treatment regarding the ovarian torsion. Thank you for watching.